Good afternoon. A man whose Medicare card had expired was asked for a $500 deposit at the Verdun Hospital. And he was told that if he didn't, he might not be able to be seen by a doctor. Now, the details of the case are in an arbitrator's report. And Kelly, it looked at disciplinary measures for that staff member.
Well, Mitsumi, that man arrived at the Verdun Hospital ER, but when he was seen, he was told that either he had to put down a $500 deposit or go renew his Medicare card. But if he didn't, he might not be seen by a doctor. The patient then left, but was back a few hours later in an ambulance and eventually needed emergency surgery. But the hospital then fired that nurse, even though they had followed protocol. And the report says that if doctors are unwilling to see patients who don't have coverage or haven't paid, it puts the problem on the triage nurses. Now today, the Centre Sud Health Board, which runs the Verdun Hospital, said that they want to assure people who are facing emergency situations they will be seen without discrimination over their means of payment and will receive emergency medical care even if they don't place a deposit. Now this morning I talked to the patient's right advocate Paul Brunet about this situation.
If you need urgent medical attention, you should be getting it. Wherever you're from, whatever your status is, we're talking about human life here. If your situation is not that urgent, you're not a Canadian citizen, you don't have any Canadian status, that's another story. But it is not because you end up at ER that you need urgent care. 50% of patients who end up at emergency should or could have been treated elsewhere. So that means that it is not because you are in emergency ward that you need urgent attention. To me, if a person has no Canadian status, wants to get medical attention that are not urgent, he should be asked to pay.
Now, it's important to note that those emergency medical fees can run into the thousands of dollars for Montreal area hospitals. I also spoke with a doctor, an emergency room doctor, who says that there should be a better system in place to determine who has to collect the money, and right now it's unfairly up to the medical staff. Mitsumi?
Thanks very much, Kelly. And that's Kelly Gregg in Verdun.